I know we've only got 15 minutes, so I'll do my best. I do apologise if we go a little bit over. My name is Khan. I graduated from the University of Queensland, and I'm studying a research master's at the moment. So it was while studying here, it led me to a number of mentoring and supervising roles. I'm not an expert, okay, but I don't have an education degree, but I learnt a lot demonstrating and mentoring and supervising, because I think that when it comes to doing those roles, a lot of us who've been working for a number of years are sort of thrown into the role without any formal training. It may be due to a lack of established programs or no real time to do any formal courses. Nevertheless, sometimes this teaching role becomes an unexpected additional responsibility to already a busy workload. I'm here to discuss a few issues in this area and hopefully enlighten you with a few key points. Any form of teaching is a challenging role, but no doubt a very rewarding experience. I would encourage you, if you haven't, to participate in supervision workshops and programs which go through supervising students in detail. You will notice that throughout this discussion, I may interchange between the terms demonstrating, supervising, and mentoring. These three terms do have different meanings. However, demonstrating, supervising, and mentoring all involve an educator, the person in the senior role, and the learner, perhaps the student or the junior dental practitioner. In clinical supervision, the educator offers support, offers wisdom, so that the learner develops an appropriate level of competence. The learner must accept accountability, responsibility, so that they work safely and in the best interests of the people in their care. You may be asked to supervise practitioners with a low level of clinical experience or perhaps new graduates. For the new graduates, they've left the safe confines of university and now have to work to earn a living. In tertiary education, the adult learning is focused on the learner. Learning is measured by exams and assignments with some clinical rating. The goal of clinical education is to provide an environment that fosters students' professionalism and encourages the development of an independent problem solver. The new graduate must develop into a reflective and competent practitioner. Before a student or newly graduated clinician even steps through the door, it's ideal to have a well-established and well-managed clinic. Get them off to a positive start by making them feel welcome, feel accepted. The entire staff must be willing to be involved in a teaching environment. I think you will all agree that a positive work environment boosts morale and promotes a healthy working culture. As supervisors or mentors, we need to show the inexperienced practitioner how to be independent and how to think for themselves. In a clinical environment, there is a merging of thinking skills and performance skills. It's natural for a new member of staff to feel nervous and a bit anxious. Some say that the relationship between the supervisor and supervisee or student must be close, like a marriage, sort of. The relationship can easily break down. Communication is very important. It's a two-way street. Both parties must be motivated to guide and be guided. There must be open conversations and feedback on performance, both from the senior and the junior. Okay? If there is a situation where you see that the student or the junior practitioner is struggling with a patient, it's better to give them space. Avoid giving them added pressure or stress. I know when I'm flustered, it's very hard to stay attentive and focused. Same thing goes for the student. If you're concerned, it's better to politely ask the student if you could have a word and talk to them in private. Okay. What are the expectations of the supervisor? The supervisor, the educator, must provide a positive and supportive working environment. The educator also needs to be aware of the student's learning objectives. This must be discussed with the student. There are important factors to consider: prior clinical experience, competencies and learning outcomes to be achieved, stage of training of the junior practitioner. In this way, the mentor will be able to contribute to the student's understanding of and competence in clinical practice. This will help with the quality of feedback provided to the student. You want to ask the junior practitioner questions such as, where have you been working? What do you know? Are there aspects of dentistry which you're not confident in or don't enjoy? What aspects of dentistry do you enjoy? What do you want to get out of this? It's important to put these points in context. Is the learner a final year dental student, a new grad, or have they been working for a number of years and have just started to come back into the workforce after a long break? As we would like to or are prone to, it is best to avoid grooming them to be yourselves, or mini-me's, as I like to call them, because we're not perfect. Okay? Our role is to provide support, advice, and ideally, evidence-based knowledge for them to become proficient and competent practitioners. Okay. So what should we expect from the young practitioner? As I mentioned earlier, it's a two-way street. The learner must first and foremost take responsibility for learning. Okay? They must have an active role and have a sense of accountability. The learner must also provide feedback to the mentor. It is good to have discussions prior to working in the clinic to ensure that the expectations of both the educator and the learner are clear. So any breakdown in this supervisory relationship is to the detriment of both parties involved. Okay? We want to be focusing on education and feedback to promote a patient-focused experience rather than a technique-focused experience. It is very easy to approach all the students in the same way. However, in the same way a group of people at a workplace are different, different personalities mean that you have to approach each of the individuals differently. It's a good idea to have an idea, it's good to have some idea of the junior practitioner's learning style. Okay? So a couple of researchers identified 4 learning preference categories. Be mindful that a learner and yourself may be a combination of these 4 different learning styles. Okay? Activists like to learn by doing. Reflectors learn by observing. Pragmatists are focused on practice and ideas that work in the real world. Theorists, on the other hand, are focused on theories and abstract ideas. For instance, activists are usually happy to have a go and jump in, but the risk is that they are likely to make more mistakes. Reflectors, however, are more thoughtful in their approach. However, they have a tendency to hold back and are more cautious. Reflectors are not as assertive as, say, an activist would be. For a reflector-type learner, you may need to, at some point, give the reflector a gentle push. I have to admit, I'm a bit of a reflector. Theorists will be thinking, will I get to ask questions? Is the treatment approach valid, or is there evidence to back this up? Okay. So this slide is focused on the supervisor-student relationship. As a uni requirement, supervisors must grade the student based on their performance and the level of competency expected of them. No one likes to do it or for it to happen to them, but sometimes you have no choice when it comes to marking a student's incompetency. Failing a student shouldn't come as a surprise to the student, especially if formative assessment evidence is used. Okay? You can't really fail them if you haven't given the student any feedback in the past. This is why regular feedback must be discussed throughout the student's placement. How do you know when a supervisory relationship is working? Based on our prior experiences, we all have our own ideas as to what factors determine the effectiveness of the supervision. We have briefly discussed aspects on supervising and on the type of learners you will encounter. A high level of communication from both the educator and learner is essential. I found that by supervising, I subconsciously reflect on my own work and think about ways to improve on my communication with the learner. Supervision is most effective when the learner is supported and clearly understands the work environment. The supervisors in a senior or principal position who have high levels of competency exercise leadership and authority. Students want placement supervisors who are available, respectful, fair, objective, who have a high knowledge and are able to directly communicate their knowledge. And also, you want a supervisor, you want to be someone who can encourage autonomy and feedback. I found that even if you're new to supervising, the level of experience you possess is more than enough to provide support and effective discussion with the learner. There is less awareness to reflect on your own work when you're practicing full time. However, it's different when you have a supervisory role on the side. You can learn a few things, especially when you've been practicing for 15 or 20 years. New graduates will have updated skills and knowledge. I remember when I was just starting out, I worked for a dentist who'd been practicing for 10 or 15 years. I, in a really, really nice way, asked him to buy a few things, including a sectional matrix system. If you don't know, they're expensive, which he did. Then he ended up trying it out, and he said to me he thought it was fantastic. And now he uses it regularly. His nurses told me he uses it regularly. He wasn't being nice, he actually does use it. Okay. Feedback. Everyone knows it's important for learning. However, it is hard to give and it's really hard to take. Okay. A good approach is to ask students questions on their performance. This makes them self-evaluate. Whether you're the learner or not, no one likes to be told what to do or what was wrong. Critical reflection involves the ability to evaluate thought processes and understand the factors that contribute to making decisions. As mentors, we want to establish the learner's skills in reflection and questioning. It is important that you speak to the student or the learner privately. Take them aside. Do not discuss things in front of their peers or patients when you're giving feedback. I would suggest that you give no more than 3 key points to the learner. You don't want to bombard them or overwhelm them with too much information. Feedback is information about how we did in light of some goal. So what is the goal? The goal or task would have been determined during discussions between the educator and learner. In our last slide, we'll go through examples of short-term and long-term goals. The feedback session is most effective when it is timely. So obviously, if they're emotional and crying, you're not going to tell them that they need to do a better job. Okay? It has to be relevant, it has to be meaningful, and it has to be encouraging. And you also need to offer suggestions for improvement. So you don't tell them what to do, you suggest it to them because they are going to be your future colleagues, and that's how you should communicate with your current colleagues. The learner under your tutelage will be looking for validation from you. So you should always say something positive, even if you can only muster the words, "You gave it a go." One of the best ways in providing feedback is getting the learner to evaluate their performance. Okay? Time should be spent on asking them questions. This forces them to evaluate their performance. You do not want to give the feedback exchange, you don't want the feedback exchange to be one way. Okay? Even if you are busy, you must provide some advice or feedback to the student. For example, if you really only have 1 minute to spare, ask the student one question. What did you learn today? Then provide them with what they did well and what they could improve on for next time. As long as the student understands the main message, you have done your job. Any feedback given has to support learning and not compromise learning. It is good for the learner to set goals. Okay? Make sure that they're realistic. Okay? So, for example, you might set a goal that they'd like to complete 3 simple restorations in a specific time frame. So it might take them an hour in the first week, and then in a couple of months you might notice that they're getting a lot more efficient. And you want to make sure that their quality stays the same as well, or that it improves. Another example to a therapist might be for them to give them a goal to fit an orthodontic band in 15 minutes rather than 20 minutes, which is what they spent last time. Okay. The idea is to give them confidence and to build their confidence in order for them to take these safe risks. Okay. When a dentist is triaging for emergency appointments, you want to give them the opportunity to set their own line of questioning and do the necessary clinical tests. Obviously, and I think you find that when they've gained your trust, if they don't know how to do it, they will ask. Okay, so you have to sort of stay open to them. Okay. And that's pretty much it. Before I let Julie have a few words, I do want to acknowledge that I learn a lot by doing supervising program and by my experiences. So as I said, I do encourage that if there is a program that there are programs available to you. It's just a matter of trying to find them and talking to the right people. Thank you.